So I'm going to talk about the special populations being tested, because I know that sometimes is something that people want to know about. So based on the public information, and this will be confirmed when the FDA does its reviews, non-pregnant adults ages 18 years and older, to include these specific segments of society, the elderly and those who are racial and ethnic minority groups, are supposed to be part of these trials. I don't have any specifics on that. That is what we're waiting for the FDA review and seeing if they believe there's enough data. These reviews should provide more information, so stay tuned. Groups to be included in future studies: children. I know this is going to surprise people, but this has been a usual practice, is that these types of studies are typically done after it's proven that the vaccine is safe and effective in adults, because the value has been that we are going to protect our most fragile in society, like children, especially if they're not at the greatest risk initially. It makes sense, but I know people are going to be disturbed that it wasn't done at the same time. But this is the standard processes for vaccines. And pregnant women have not been, excuse me, enrolled initially. However, having said, those studies will happen, but obviously they don't know when people enroll in these studies, men and women, if those who are able to get pregnant actually become pregnant during that time frame. So they may have some data, but I'm not promising it yet. So that's what I'm looking for, and my colleagues at the state level are looking for, and in the region. What is the real information about what is known and not known from these studies? And we're talking these studies have involved between 30 and 40,000 people, and that is about the normal size for these sorts of trials. So where do we stand with vaccine in Virginia and Arlington? So some of you know that the Advisory Committee on Immunization Practices did a prioritization meeting early on December 1st, 2020. And they basically decided to agree with the recommendations from the National Academy of Sciences about prioritizing healthcare personnel and long-term care facility residents. And that fits with their principles, and they're published, so I'm not going to review those. But healthcare personnel, as they defined it, are paid and unpaid persons serving in healthcare settings who have the potential for direct or indirect exposure to patients or infectious materials. And that includes long-term care facility staff. And then the long-term care facility residents are defined as adults who reside in facilities that provide a variety of services, including medical and personal care to persons who are unable to live independently. And that committee's recommendations had to be approved by the CDC director, and it has been done. As I've mentioned, the FDA is having meetings to review the emergency use authorization requests. December 10th is the Pfizer review for its messenger RNA vaccine, and Moderna, it's December 17th, also for its messenger RNA vaccine. And then after those approvals, the ACIP is supposed to meet again. So if FDA approves what are these vaccines, what are the next steps in Virginia and Arlington? I want to remind everyone the Arlington County Public Health Division has another name. It's the Arlington Health District. We're one of the 35 health districts in Virginia under the Virginia Department of Health. So we are going to have the same access, obviously based on whatever our personal characteristics are, makeup of those populations. And they want to remind people the reason why we're vaccinating is because of the very potential of the pandemic as we've seen it in this rise. Virginia is preparing to receive a total estimated 480,000 doses of vaccine from the two manufacturers if they're approved. I don't have the specific ratios at this time. And as a reminder to everyone, the actual amount received is a moving target and dependent on vaccine manufacturer output, but we're getting more confident that's roughly what we should be getting. That with the VDH estimate that there are up to 500,000 healthcare personnel, including the staff at long-term care facilities, as well as the long-term care facility residents in Virginia, means that we should be able to vaccinate the majority of those categories, if all goes well, with their first dose of vaccine in December and January when this stuff all happens. The devil, of course, is in the details. VDH is working with the Virginia Hospital and Healthcare Association, or VHHA, to prepare the health systems that have the ultra-cold chain storage ability to receive these first shipments, because it has to be done safely, and you don't want to go through the expense of creating all of this and then not maintain the vaccine at the appropriate temperature, because the mRNA technology, because it's a natural process in the cells, and it's not supposed to last very long. The instructions break down, so we don't want that to happen before we're even able to actually provide the vaccine. All of the initial doses will be distributed to various healthcare systems with that capacity, and the plan is that those healthcare personnel that directly care for COVID-19 patients or in support of that will receive top priority first. Let me see what next. We expect the second doses at the appropriate time. For these vaccines, it's the effectiveness data showed that it required 2 doses. So if you have dose on day 1 or day 0, sorry, then one of the vaccines requires immunization again 21 days later, the other 28 days later. And so we expect, based on what we've been told from the federal government, to get the second doses at the appropriate time. And obviously people have this question, so as future weeks bring more deliveries, we expect that there could be overlap in the doses being administered. That is, some getting first doses and others second doses in the same weeks. People will want to know what we as a division, health district, and the county have been doing. In broad strokes, while we've had plans for years for mass vaccination, obviously the wrinkle is incorporating 6-foot distances to those plans. And all of the plans here and elsewhere, we have to build in appointment schedules, because you don't want people to congregate in lines and pass germs to each other. So this is something that all states and localities are going to have to deal with. And it's just, I think one of the things we have to remember is this is part of current COVID reality. We've been working on the ultra cold chain storage issues by ordering these for ourselves and our partners who don't have them. And finally, we are working on training on these procedures, including training on the vaccine when that information is finalized by FDA, the manufacturers, and VDH. So a lot of this is significant moving parts, and we need to have those things in place. And so, as our county manager, Mark Schwartz, has indicated, we need to be prepared for changing information. I know our community, as everyone else, is anxious to be over with this, and we ask for patience because things will change. And a few last comments on vaccine before letting you ask questions. How much will the COVID vaccine cost? The vaccine itself will not cost anyone anything. These are the miscellaneous points. Providers who can charge to insurance are allowed to do that. VDH is not going to charge that for any of the public clinics that the health districts run. We don't want any barriers, especially for our at-risk populations. And as a reminder, how many doses of COVID vaccine will be needed, and will a booster dose be needed? We don't know for sure yet. We obviously know how many doses are needed for the vaccines coming out. The 2, if they're approved, it would be 2 doses. There is one that would only require 1. However, as time goes on, we will learn whether future doses are needed, like needing a tetanus shot every 10 years. Obviously, we won't know that information because we've only had 4 or 5 months with the studies that they've done. And so I hope people will be reasonable in their thinking about this, that we can't have more information than time is actually allotted for us. With that, I am turning it back to you, Madam Chair.